Hey guys, I've heard from quite a few of you about a paper that was recently published, and I've got a copy of the actual paper here. I'm going to walk you through it a little bit. It's a really interesting paper out of Israel. It was just published in the journal Aging, and in 2020, of course, but it was actually published on November 18th, 2020. I think a lot of you saw sort of the headline that this made. It was use of hyperbaric oxygen therapy to increase telomere lengths and decrease immunosenescence in blood cells. This was a prospective trial. So let me just walk you through this because I think it's a fascinating paper. It points in certain directions, and then there's a few things that need to be sorted out, I think. But essentially, we've gone through the hallmarks of aging. I think you probably know that there are at least 9 hallmarks of aging. I think there are probably 11 or 12, but there are 9 sort of classic hallmarks of aging. One of those, of course, is telomere shortening. Another one is the increase in the presence of senescent cells. And as you recall, senescent cells are ones that are basically inactive, or even worse, they become secretory and they actually sort of poison the environment and make it harder for other cells to do their job. And it's really a big part of the whole aging phenotype. So part of the young blood experiments was actually removing senescent factors from older mice and actually watching them get young again. And that work is being carried on in other places like Berkeley and things like that. So that's another conversation. But senescent cells actually kind of are part of that cascade of making us old, and then short telomeres, of course, lead to senescent cells. So these two are intermixed. Now, the study that they did is interesting because they chose to use hyperbaric therapy, and they used hyperbaric therapy in a German chamber. It's actually a large one. A lot of hyperbaric chambers, you're kind of laying down. It almost looks like you're inside of an iron lung or something. But this is one that you could sit in. It was actually quite a big chamber. They took you to 2 atmospheres of pressure, hyperbaric, of course. This is used for scuba diving and things like that to keep somebody from having the bends. They put them in pressure to put the nitrogen back into their blood. But in this case, they were at 2 atmospheres of pressure, and they were in there for 90 minutes, and they were in there 5 days a week for a total of 60 sessions, so for 12 weeks. They did blood work 30 sessions in, 60 sessions in, and a couple weeks later. The other thing was they were breathing 100% O2 while they were in the hyperbaric chamber. They did, every 20 minutes, they took a 5-minute break from the 100% O2 because 100% O2 can be toxic to the lungs. And so people talk about high O2 is great, high O2 is great, but actually O2 is very toxic to the lungs. So they took 5-minute breaks every 20 minutes for the hour and a half that they were in the chamber. Now, there's an interesting paradox here because you're using 100% oxygen, you're using hyperbaric pressure to push the oxygen into the tissues, and yet at the tissue level, what happens is a hypoxia or low oxygen response. So this is considered the hyperbaric hypoxia paradox, okay? And this is the hermetic stress that they were utilizing to sort of stress the system. So sitting in a chamber, 100% oxygen, and yet your tissues are experiencing hypoxia. And they actually measured the release of hypoxia factor as part of what they did, HIF. So hypoxia inducing factor. Now, what they measured was they then looked at white blood cells. And so the situation there with the white blood cells is that, and we measure this currently and have measured it for many of you with a test that we send to UCLA. They essentially were measuring the fractions of helper cells, B cells, which are the antibody producing cells, the natural killer cells, which are just sort of naturally there to kill, and then the cytotoxic T lymphocytes as well. So you may remember that the T lymphocytes have 2 subpopulations. There's the helper cell population and the cytotoxic population. So they looked at all 4 of those populations of cells. And what they noticed was that when they measured, compared to baseline, at 30 sessions in and 60 sessions in, that there was an increase in telomeric length. Now, it's interesting because when you actually look at the data, the telomeres may have increased by, say, 20%, plus or minus 20% or 23%. So it gives me the impression that there really was a wide range of responses to this, okay? And it turns out that really the only significant responses, or the most significant responses, occurred in the B cells. Then they also looked at signs of senescence, which we also get regularly for you guys on the UCLA test that we get. We can actually see your percentage of senescent cytotoxic cells. They were looking at a very similar thing. And what they showed was that the senescent cells seemed to go down. Now, independent of measuring the immune system, they then went ahead and actually measured telomere lengths. And so that's where I was talking to you about, and that was with a different assay, telling you that it would increase by 20% plus or minus 20%. So at the end of the day, when they had done all this, they basically had shown that in a hyperbaric environment, if you were willing to spend 90 minutes for 5 days a week for 12 weeks, that you would have a benefit from this. Some of the benefit peaked out at just 30 sessions, but some of it actually carried through all the way to the 60 sessions where you got the maximum benefit. So I think this is really fascinating because, number one, it shows that hormetic stresses do tend to improve telomere lengths and prune senescent cells. They actually compared it to things like exercise, which can do the similar kind of thing, but only to 5%, and they were getting more on the order of 20%. So this is kind of a nice move in that direction from the standpoint of, can we increase telomeres, lower senescent cells? Is there a technique we can use to get us there faster? Now, I don't know how many people have the time to spend 90 minutes, 5 days a week in a hyperbaric chamber, breathing 100% O2, every 20 minutes take a 5-minute break and go back to it. But what I'm encouraged by this is that we're showing that if there are levers that we pull, we can actually start to move this forward, where we're both lengthening telomeres and decreasing senescent cells. You're probably aware that there are many companies out there working right now developing senolytic drugs, which are drugs that actually will poison senescent cells and prune them from your body. And not 100%, of course, you never want to take anything out 100%. Senescent cells do play a role. They're very important for wound healing and some other things. But when they build up and you get these senescent cytotoxic cytokines in your system, they really add to the phenotypic aging process. You have less energy, your mitochondria go down. There's a lot of interplay between telomere lengths and mitochondria also. So anyway, this whole getting tired, wearing down, blah, 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 and then that cratering that happens is tied to these mechanisms. So bottom line, very encouraging, nice to see the interplay between the two, nice to see that we can move the needle. I'm looking forward to actually seeing more data. It was a small study, just had 30 people in it, and maybe we can find a way to actually get better benefit or bigger benefit, or one that doesn't seem to bounce around quite as much, using a little bit different techniques. We do know that saunas are hermetic stress. We know that ozone saunas are hermetic stress. We know that exercise is hermetic stress. Maybe there's some combination there with certain things that we can do that would help us get there faster or with less time invested. So anyway, that's my take. Really a great study. I appreciate all of you that have reached out to me asking me about it. I wanted to do this video just so you have my sense of where we stand with it. And we'll go from there. All right, thanks.